After 2,074 pages and trillions more in government spending, massive new taxes, and $500 billion cuts in Medicare, most people, Mr. President, according to the Congressional Budget Office, most people will see their insurance premiums go up.
Drive up the cost of premiums.
Insurance premiums are increasing.
Both the House bill and the Senate bill will raise premiums, not lower them.
Increasing premiums.
Premiums are going to go up.
The parts of the bill that would begin immediately are the taxes.
To raise taxes.
Massive tax increases.
There's just one tax after another.
We're going to tax drug companies. We're going to tax medical device companies.
Big fat tax increases.
$500 billion in cuts to Medicare that are cuts which are unspecified.
Taking $464 billion out of Medicare.
$465 billion in cuts in Medicare.
Cuts in Medicare.
The cuts in Medicare.
Cut in Medicare.
Reduce Medicare spending by $400 billion.
And to talk about passing a health care bill that is going to add $2.5 trillion in cost.
$2.5 trillion cost.
$2.5 trillion over that 10-year period.
Lamar Alexander, in your discussion with him, said it could be like immigration. Immigration was defeated by a popular uprising out in the country. They had 64 votes to proceed to the bill.
And there's still some big differences among Democrats on this bill.
What now, $100 million in federal funds had to be channeled to Louisiana? They're calling it the Louisiana Purchase.
The vote today should in no way be construed as an indication of how I might vote.
If the public option is wrong, if the Class Act is still in it, if there are a whole host of other items, I wouldn't vote to get it off the floor.
If the public option is still in there, the only resort we have is to say no at the end.
I'm promising my colleagues that I'm prepared to vote against moving to the next stage of consideration.
I don't want 4 Democratic senators dictating to the other 56 of us.
It is truly an historic piece of legislation and will be remembered as such.
This bill is historic in its arrogance.
We need to slow down and start working together, step by step.
Allowing states to sell policies across state lines, medical liability reform, health savings account.
A step by step.
A step by step.
We've got to take the time to do it right.
We can't rush this. We need to get this right.
And there were artificial deadlines that were set time and time again, from March to April to May to June, July, August, September, October. It's gone on. Christmas now is the deadline. State of the Union's a deadline. Why not just try to get it right?
But I would suggest we put aside the health care debate until next year, the same way we put cap and trade and climate change, and talk now about the essentials, the war and money.